Assalamualaikum, my name is Najasa actually. So I will explain about the introduction of the Acyclovir and the pharmacokinetic of the Acyclovir. So let's move to the introduction of the Acyclovir first. So what is the Acyclovir? Acyclovir is a medication designed to fight the infection caused by the virus. Specifically, it targets the herpes virus family. It doesn't cure the infection but helps to manage and control the symptoms. So why is acyclovir used? Acyclovir is mainly used to treat the infection caused by two common type of the virus, which is herpes simplex virus (HSV). This virus can cause the oral herpes, also known as cold sore that are small, painful blisters that typically appear around the mouth or lips. Genital herpes. The herpes involves sore and outbreaks in the genital area, which can be painful and uncomfortable. Second is varicella zoster virus (VZV). This virus is responsible for chickenpox, a common childhood illness that causes itchy, fluid blister on the skin. Shingles, reactivation of the chickenpox virus in later life that leading to a painful rash or other condition. Acyclovir also can be used in the other situation, which is for the eye infections. The herpes virus can infect the eyes, leading to the irritation or damage if untreated. Weak immune system. People with the weak immune system, such as those undergoing the chemotherapy or living with the HIV, are more vulnerable to severe infection. Acyclovir helps to prevent or manage this infection. Pharmacokinetics of acyclovir. Focus on the absorption first. Absorption is referred to how a drug enters the bloodstream after being taken. For the first one is oral acyclovir, tablets or liquid. When you swallow the acyclovir, it goes to your stomach and gut, where it's absorbed into the blood. So the absorption is poorly. Only 15 until 13% of the drug is actually gets into the bloodstream. For the example, if you are taking 100 mg of oral acyclovir, only 15 until 30 mg enter your blood. This low absorptions means you might need to take the higher or more frequent dose to get enough drug in your system. This is crucial to fight the infection. For the next is IV acyclovir. With IV acyclovir, the drug is injected directly into your vein. So this method will skip the gut entirely, so 100% of the drug will enter to your bloodstream. For the example, if 100 mg of acyclovir is given through an IV, the entire of 100 mg is available in your body. So IV acyclovir is used in serious infection or when the oral route is not effective. Third is topical acyclovir, cream or ointment. When applied to the skin, acyclovir sticks mostly to the surface to treat the local infection like cold sore. Very little, if any, of the drug is absorbed into the body. So this is why the topical acyclovir is work well for localized the symptom but cannot be treated more widespread or internal infection. So next is the distribution of the acyclovir. It's all about where the drug goes in the body after it enters the bloodstream. This is how the acyclovir spreads tissue it reaches. Acyclovir travels to many tissues in the body, such as skin to treat cold sore and genital herpes, liver, lungs, and intestine, part of the body where the virus may spread. Fluid it enters, it dissolves into the blood and spirit to various body. Fluid saliva helpful for fighting the oral herpes, CSF. This is the fluids around your body and spinal cord. Acyclovir reaching the CSF makes it effective for brain infection like the herpes encephalitis. Vesical fluids, this is the liquid inside the blister caused by the herpes or shingles, allowing the acyclovir to work directly at the infection site. Cross the blood-brain barrier. The blood-brain barrier is like a protective shield around your brain, and not all the drug can pass through it, but the acyclovir can cross this barrier and making it effective for the treating viral brain infection. In breast milk and placenta, the acyclovir can enter the breast milk, so it might pass to a breastfeed baby in stomach, it also crosses the placenta, meaning that a pregnant woman can taking the acyclovir could pass into her baby, but it's usually considered safe and prescribed by a doctor. Moreover, the metabolism. So what does minimal metabolism mean? So when you take the drug, your liver often change the metabolize it into the other form before it works or it's removed from your body. So for acyclovir, the liver does very little of this. Most of drug is stay in its original form. So why does this matter? So since the acyclovir is already active in its natural form, it doesn't need much processing by the liver to work against the virus. So this is also means less strain on the liver, making it a safer option for people with the liver problems. So what happened to the unchange of drug? So after circulating in the body to fight the virus, the unchanged drug is filtered by the kidney and it will extract in the urine. So this is why the proper kidney function is important when taking the acyclovir. So lastly is the excretion. How the acyclovir leave the body. So the acyclovir is mainly removed from your body through the kidney. So the drug will end up in your urine. So you will peel it out. How the kidney work in excretion. So glomerular filtration. This is like the filtering the system in your kidney that pulls out the waste and drug like acyclovir from the blood. So tubercular secretion. This is an extra step where your kidney will actively push more the drug into the urine to get rid of it faster. So the half-life of the acyclovir. The half-life of the acyclovir is about 2.5 until 3 hours in people with the normal kidney function. This is mean it takes 2.5 until 3 hours for half the drug to leave your body. If you are taking 100 mg, only 50 mg will remain after 3 hours, and then 25 mg after another 3 hours, and so on. So because the body clears it fairly quickly, you might need to take the acyclovir multiple times a day to maintain its effect. So kidney problem affect the excretion. If your kidney doesn't work well, the acyclovir will remain into your body for the longer and increase the risk of the side effect. In such a case, doctor adjust the dose or timing of the medication. This is to prevent the drug from building up to the harmful levels.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sarina Najwa. My number matric 076986. Today I will explaining the pharmacodynamic of the acyclovir. This slide highlight how the acyclovir works in the body, focusing on its mechanism of action and its selective targeting of the virus-infected cells. First, let's look at the mechanism of actions. Acyclovir is a prodrug, meaning it inactive until it activated inside the body. When activated, it only works in virus-infected cell. This makes it highly selective and safe for normal cell. Now, let's break down what happens inside the infected cell. Step 1, viral enzyme play a key role in activation. Specifically, viral thymidine kinase converts acyclovir into the acyclovir monophosphate. Step 2, host cell enzyme then further converts this into the active form, acyclovir triphosphate. Step 3, the active acyclovir triphosphate interferes with the viral DNA synthesized into two main ways. It competes with the deoxyguanosine triphosphate, a building block of the viral DNA. It causes termination, meaning the virus can no longer replicate because it lacks the necessary DNA structure to grow. This selective mechanism ensures that only virus-infected cells are infected, leaving healthy cells unharmed. To summarize, acyclovir is a selective antiviral drug that targets a virus-infected cell by interfering with the viral DNA replication. Its activation depends on viral enzyme, which is why it's so safe and effective for treating viral infections like herpes. Next, acyclovir category as antiviral. Class imidazopyrimidines, subclass purines and purine derivative. Acyclovir is an antiviral medicine. It used to treat infection caused by virus like shingles, herpes zoster, Adult will take 800 mg 5 times a day for 7 to 10 days. For chickenpox varicella, adult will take 800 mg 5 times a day for 7 to 10 days. For kids older than 2 years, the dose is based on the body weight, 20 mg per kilogram, 4 times a day for 5 days, up to 800 mg per dose. Then, for cold sores of genital herpes, herpes simplex virus, for the first infection, 200 mg 5 times a day for 10 days. For repeat infection, 200 mg 5 times a day for 5 days. If you have a kidney problems, your doctor might reduce the dose because the kidney help the filter out the medicine. Remember, Acyclovir also comes as a cream for the skin infections like cold sore. Always follow your doctor's instructions and complete the full course of medicine for the best result. Okay, let's talk about the therapeutic effect of the Acyclovir. First, it relieves a symptom. It reduces pain, itching, and sore caused by the herpes infections. Second, prevents prick. Acyclovir lowers the chance of the passing the herpes virus to others, especially during genital herpes treatment. Lastly, prevent reoccurrence. When used regularly, it can help stop herpes outbreak from the happening again, especially in people who get them often.
Assalamualaikum warahmatullahi wabarakatuh. My name is Aini Nabila binti Jaafar. My metric number is 076459. Today, I will present about side effect of Acyclovir. Side effect of Acyclovir, it can affect to the digestive system, central nervous system, and dermatological reaction. For digestive system, the patient may feel nausea and vomiting, stomach pain, and diarrhea. When taking Acyclovir by mouth, or we call as orally, the Acyclovir can irritate the stomach lining. So this irritation can trigger the patient to vomit, and this irritation also can lead to mild pain or cramp the patient's stomach. For diarrhea, the Acyclovir can disrupt the balance of bacteria in the gut. Normally, our gut has a good bacteria to digest the food. When the balance of bacteria disturbed, it can lead to the loose stool, or it called as diarrhea. Next is impact to the central nervous system. Acyclovir can make the patient feel fatigue, dizziness, and headache. Acyclovir normally taken for fight the virus, so the body might allocate more energy to the healing process and make the patient fatigue. Other than that, the headache also occur when taking Acyclovir in a higher dose because it can lead to discomfort of the brain in the form of headache. Lastly, the Acyclovir can slow down or depress the activity of CNS, which can cause of dizziness. Lastly, side effect to dermatological reaction, which can affect the mild allergic reaction, serious skin reaction, and injection site issue. For mild allergic reaction, the patient may experience rash or itching or redness. The symptom usually can relieve normally without treatment. For serious skin reaction, it is rare, and the patient may experience Stevens-Johnson syndrome, which can affect in large skin area, and the patient's skin may have a blister. The patient also feel a fever and flu. Lastly, injection site issue happen because the patient taking Acyclovir by IV, and it can irritate the injection site and making it swollen, red, or sore. Secondly is adverse effect. Adverse effect happen when the patient taking a normal dose of drug, but it cause a effect. It will call as adverse effect. Adverse effect for Acyclovir have 3, which is neurological adverse effect, renal toxicity, and hematological effect. The first one is neurological adverse effect. For neurological adverse effect, it is involve the brain and the nerve of the patient, so the patient will unable to think clearly and unable to process the sensory information. The symptom that patient may feel is disorientation, which is the patient may unable to recognize surrounding, agitation, the patient may feel restless and unable to stay calm, and hallucination, which is the patient may see unreal thing surrounding it, and the lastly is tremor or shaking. This happen because the overstimulation of nervous system that can lead to uncontrolled or shaking the movement. The second one is renal toxicity. Renal toxicity happens because of impaired kidney function, or we call as crystalluria. Crystalluria is a drug crystal formed in the kidney and a block to the kidney function to excrete the urine output. Patient may feel three symptoms in renal toxicity, which is fatigue that related to impaired kidney function, the reduce of urine output because the crystalluria can block the kidney to excrete the urine, and edema because the reduce of urine output and the fluid in the body build up more and can lead to edema. Edema can happen in the leg and swelling it because of fluid retention. The third one is hematological effect. The patient may feel thrombocytopenia, which is the reducing of platelet count in the blood. Other than that, the patient may feel leukopenia, which is the reducing of white blood count in the blood. It can increase the risk of infection because the white blood cell function is for fight the bacteria in the blood. Lastly is anemia, which is the reduction of red blood cell in the blood and can reduce the oxygen to the body. Lastly is contraindication. The contraindication meaning that the drug is not recommended for the patient with certain disease because it can lead to severe complication to the patient. There are three contraindications for drug Acyclovir, which is hypersensitivity, renal impairment, and dehydration. For the first one is hypersensitivity. Patient with mild reaction, which is have a symptom like itching, swelling, or rash, cannot get the Acyclovir. The other one is severe reaction, which is anaphylaxis. Anaphylaxis is condition where the patient with low BP because it leads to dizziness. The secondly is rapid heartbeat, which is a sign of allergic reaction. And the third one is breathing difficulty, which is the sign of swelling in the airway, which is respiratory system. The third one is renal impairment. Renal impairment is contraindication because the kidney function is responsible to clearing the drug out from the body. When the kidney is dysfunction or unable, it can make the Acyclovir build up in the body and can lead to the severe risk such as kidney damage that lead to crystalluria, toxicity because of excessive level of drug in the body, and can give the neurological symptom. Lastly is dehydration. Dehydration can increase the risk of crystalluria. For simple understanding is when the body is lack of water, Acyclovir can make the urine is more concentrated, which is can lead to formation of crystal, which is a crystal of Acyclovir that may block the kidney function to excrete the urine output.
Assalamualaikum, my name is Nur Happina binti Azmi. My number matric is 077154. So today I will explain the nursing care for the administration of Acyclovir, which is a medication commonly used to treat viral infection like herpes simplex and varicella zoster. The first step is assessment, which involves gathering important information about the patient before giving Acyclovir. For patient history, firstly, we need to assess for any allergies, especially to Acyclovir or severe antiviral medication. Secondly, evaluate the patient renal function by checking lab results like serum creatinine and BUN because Acyclovir can affect the kidney. Secondly, confirm the indication for the medication such as treating an active infection or using it as prophylaxis. For hydration status, assess for sign of dehydration since dehydration increase the risk of kidney complication. If needed, encourage fluid intake to ensure the patient is well hydrated before administering the medication. Goal for administration of Acyclovir is to ensure the medication is administered safely and effectively while minimizing potential complications such as kidney toxicity, reduce viral symptoms, and promote patient recovery. Based on the assessment, there are three nursing diagnoses related to Acyclovir administration. The first one is risk for impaired renal function related to potential nephrotoxicity of the drug. Second one is risk for third comfort related to possible side effects such as nausea, headache, or infection site irritation. The third one is risk for infection transmission related to active viral infection and inadequate infection control practice. Next, let's talk about nursing intervention which focus on proper administration and patient monitoring. For preparation and administration, Acyclovir can be given through referral route, which is oral route, intravenous route, and topical route. For oral route, administer Acyclovir with or after meal to minimize gastrointestinal upset. For intravenous route, for IV administration, dilute the medication as per guidelines to reduce irritation to the vein. Administer it slowly over 1 hour to prevent nephrotoxicity and irritation. Use a large vein or central line if possible. For topical route, when applying Acyclovir topically, use glove or cotton swab to prevent spreading the infection. For patient monitoring, firstly, monitor the patient urine output and renal lab result to detect any sign of nephrotoxicity yearly. Second, check the IV site for redness, swelling, or sign of phlebitis. The third one is watch for side effects such as nausea, vomiting, diarrhea, dizziness, or allergic reaction like rash or itching. The fourth one is observe the improvement in the patient symptoms such as lesion healing and pain reduction. Patient education is an essential part of nursing care. First, explain to the patient that Acyclovir is used to treat or prevent viral infection and emphasize the importance of completing the full course of treatment even if symptoms improve. Second, encourage the patient to drink plenty of fluid to protect their kidney from potential damage caused by the drug. Third, educate the patient about possible side effects like nausea or headache and instruct them to report severe symptoms such as a rash or difficulty breathing. Fourth, teach the patient to minimize the risk of spreading the infection by avoiding contact with others during active outbreaks or practicing proper hygiene. Finally, after giving Acyclovir, we evaluate its effectiveness by checking if the patient's symptoms like pain or lesion are improving. Second, make sure they are following the treatment plan and staying hydrated. And lastly, check that there are no severe side effects and assess if they understand how to manage their condition.
Assalamualaikum, my name is Nur Samiha binti Sobahi and my metric number is 076525 and I will presenting help teaching for patient which are divided to three, general, side effect and diet. In general, Acyclovir is an antiviral medication that used to treat infection like herpes, shingles, and chickenpox. It helps to reduce symptoms and control infection but does not cure it. This medication should take as prescribed with water and add evenly spaced time for the best result. For side effect, patient may have common side effects which are mild nausea, vomiting, diarrhea, dizziness, or headache. Fatigue or abdominal pain may also occur but are usually temporary. Besides that, patient also can have rare but serious side effects like allergic reactions such as severe rash, itching, or swelling. And then also kidney problem, which are indicated by reduced urination or swelling in the hand or feet. Neurological symptoms, also one of it, which are like confusion, mood changes, or seizures. If severe side effects occur, the patient should stop the medication and seek the medical attention immediately. For diet, patient should drink plenty of water to avoid kidney problem. Patient also need maintain a balanced diet which rich in fruit, vegetable, whole grain and lean protein to support healing. The most important thing, a patient should avoid alcohol as it can worsen the side effect like dizziness or nausea.